Welcome to our presentation on anxiety, Masterclass in Psychiatry. I'm Dr. Tettey Doe, psychiatrist practicing in the United Kingdom. And these are the outline. I'll be dealing with the symptoms, mental states, types, comorbidity, and anxiety management. First is the symptoms. They are what we call autonomic arousal symptoms, which include sweating, palpitation, and dry mouth. There are also symptoms of chest and abdominal system, which include breathing, which is usually rapid breathing, what we call hyperventilation. There's also chest pain and nausea, feeling sick. Mental states symptoms also include lightheadedness and fear of dying. There are types of anxiety, which is the next. These include traumatic, and these can be PTSD, that's post-traumatic stress syndrome, acute stress and adjustment reactions. Another type of anxiety are the non-traumatic specific, like agoraphobia, social anxiety, and specific phobias or fears. There's also another type called episodic, which is in the form of panic disorder. Another form is the non-episodic and non-specific. This is the GAD, generalized anxiety disorder. One needs to confirm these symptoms and also confirm the type of anxiety disorder. And also it's important to elicit if there's self-harm. The next is comorbidities. Anxiety can coexist with depression. It can be associated with substance misuse, also in OCD, obstetric compulsive disorders, which I'll touch on in another presentation, and also physical illness can relate to anxiety. And the NICE guidelines, as amended, recommends a stepped approach in anxiety management, which is the next subtopic. In panic disorder, the following are suggested: CBT, that's cognitive behavior therapy, and also, if that's not helping, then SSRI, which is specific serotonin reuptake inhibitors as antidepressants, can also be used, as well as self-help, but not for benzodiazepines. The next form of anxiety, which is the generalized anxiety disorder, one recommends benzodiazepines for 2 to 4 weeks only because it's addictive. And CBT can be started and then introduce SSRIs as well as self-help. In the management of anxiety, one can look at it in terms of one, medication with antidepressants as a long term, treated for 6 months minimum, and benzodiazepine, as we know, is addictive, so one needs to use it for short term only. The second in anxiety management broadly is what we call the graded exposure with relaxation, which will be mentioned in another presentation. The next is learned control and learned breathing, learned controlled breathing. The next is CBT, cognitive behavior therapy. Also, family input is important. And also, we look at prognosis, and the outcome is that many see improvement in anxiety management. It's also important to have psychoeducation about this condition for the patient and the carers of family. So, thank you very much. We've come to the end of anxiety, and I wish you all the best in your career. Bye.